In the northwest region of Cameroon lies Misaje Subdivision, a community rich in culture and tradition, but challenged by limited access to healthcare. For years, mothers and children here have struggled silently with preventable illnesses, long distance to healthcare facilities, and weight of poverty. Every year, the Unite for Health Foundation works together with health institutions in the Misaje subdivision with one mission: to bring healthcare closer to those who need it most. What has now become a yearly campaign is more than just an outreach, it is a lifeline. This year's campaign reached 300 women and girls. In Dumbo village alone, 50 pregnant women, 50 lactating mothers, and 25 young girls received medical support, feeding bottles, and hygienic pads, making a total of 125 beneficiaries. In the Misaje town and surrounding villages, an additional 100 pregnant women, 50 lactating mothers, and 25 young girls were blessed with emergency delivery kits, feeding bottles, and hygienic pads. Together, these numbers reflect a community-wide impact that is felt in homes, families, and the future. After receiving health talks and mama kits ready for delivery, these beneficiaries in Dumbu shares knowledge gained and their gratitude to the foundation.
I don't benefit, say I don't can register clinic, my first clinic today. So I'll be very happy. And I don't come for here again. I learned how they fit part. And we don't benefit the part them. I see I say person we know we know how for part. If he part, I'm me a belle woman. I don't benefit plenty things them. Why they carry on for here?
I learned say mommy pikin get to chop fine before if he feed the pikin say may pikin be healthy. Then I learned too about family planning. I talk for Unite for Health. Say I be very happy for the program. Say we'll be glad if plenty we fit get plenty opportunity then for say they can teach we again so that we fit learn with some mommy pikin them too way maybe there not be opportunity for them here today.
I got my package, my gift, so I'm very grateful. I'm very happy.
Behind the statistics are human stories. In Dumbu, a young woman explained how she once walked half a day to reach the nearest clinic. Today, she received healthcare in her own village, along with supplies that ensured her child's nutrition. For her, this campaign was not just about medicine, it was about being seen and remembered. A young girl among the beneficiaries in Dumbu reflects on how the campaign has influenced her outlook on health and well-being.
I've learned how to wear my pad and how like things I can do when pregnant, like, things I can eat when pregnant.
I've learned that as a girl, when you're in your menses, you need to use a pad. I have to tell them thank you and that God should bless them.
Health workers also played a crucial role. Beyond distributing medicine and supplements, they provided education on maternal health, hygiene, and childcare. These lessons, though simple, carry the power to prevent complications that too often lead to tragedy. One of the health workers on the front line of the campaign explains the importance of health education and the challenges of reaching remote villages.
I presented on prenatal care, hygiene in pregnancy, and vaccination. And I gave a brief summary on the vaccination calendar, importance of vaccination.
These are routine scans that women are not able to have because among the 50 women I did today, only one told me she did a scan, and over 49 are those that are scanned today. And they were very happy taking home the message, how their babies are presenting, how their babies are faring, and the counseling, and even the sex of the baby.
I did some series of tests for the pregnant women. I did hepatitis B, hepatitis C, and random blood sugar for the pregnant women.
In health, we believe that health education is one of the minimum package of activities that we offer at the level of our health centers. So with this, we believe if not 50%, it will go a long way, because I believe they paid a lot of attention while listening to it, and in our community there's great improvement. when it comes to health, there is great improvement. So I believe it will really do a lot.
In Misaje, the campaign grew into something larger than health service delivery. Families gathered, leaders participated, and the atmosphere reflected a movement of solidarity. It became a reminder that healthcare is not just the responsibility of government institutions, but a collective effort sustained by community and partners. Madame Difo Philomen is the country coordinator for Unite for Health Foundation. She explains why the organization returns to Misaje Subdivision every year and the impact it brings to the people.
Today in Dumbo Integrated Health Center, we had some health education for all the women, because the education cut across every sector of their lives. So we had health education on the prenatal health, family planning, complications during pregnancy, and of course, menstrual hygiene management. From our entire activity of today in Dumbo Integrated Health Center, the young ladies had knowledge on the menstrual hygiene management. As we had a demonstration, after educating them on menstrual hygiene management, we demonstrated how they use the sanitary towels. And for the pregnant women, they have had education on the prenatal care, family planning, so that their health can be preserved, and of course, complications of during pregnancy.
The results were immediate. Mothers left assured, young girls received guidance, and families embraced the hope of a healthier future. Yet the challenges remain. Poor roads, scarce health infrastructure, and limited permanent staff continue to weigh heavily on rural health care. Still, what has happened in Misaje and Dumbo is proof of what is possible. It shows the strength of a yearly commitment and how a simple idea to safeguard lives and improve health care can transform lives. From the surmise of children to the relief on the faces of mothers, the campaign has brought light into homes and renewed the community's belief that health is not a privilege for the few, but a right for all. In the words of one elder, when the health of women is secured, the health of the whole community is protected. Unite for Health Foundation is out to combat maternal and child mortality by providing accessible health care to underserved communities in rural Africa, one village at a time. For Misaje Subdivision, the journey continues. The yearly visit of the Unite for Health Foundation have planted a seed of resilience, compassion, and hope, one that grows stronger with every return.